Hi everyone, this is Dr. Madhuri from Team MDSCONQUER. So in this video, you'll see the classification of the wounds, and also there are very few important factors which will influence this wound healing. So we'll have a look of these factors also in this video. So this is the classification of the wounds. Wounds are maybe a simple wounds which involves only the skin, or a complex wounds that means it involve along with the skin it may involve the vessels, nerves, tendons or bones. And the closed wounds examples includes contusion, abrasion, hematoma. And there are open wounds like incised wounds, lacerated injuries, crushed injuries, penetrating wounds. And are also there tidy wounds and untidy wounds. And there is a clean wound, clean contaminated wound, and a dirty wound. So these are the types of wounds. So here in this table, the definition and the infection rate of each wound is given. So for the clean wound, the definition means it is an wound of electrosurgery. That means here in surgeries, the incisions or something made in the surgeries comes under the clean wounds, and the infection rate of this clean wound will be of only 2%. Okay, whereas clean contaminated wound means wound where hollow viscera are entered with a minimal contamination. So if the wound is involving the hollow viscera with only a minimal contamination, it is called as a clean contaminated wound, and the infection rate of this clean contaminated wound will be of 10%. Whereas if the wound enters the hollow viscera with a uncontrolled spillage, then it is called as a contaminated wound, and the infection rate of this wound will be of 20%. Okay, and finally the dirty wound means the wound with the pus in the operative field is called as a dirty wound, and the example of this type will be of either a abscess drainage, and the infection rate will be of greater than 50% in this type of wounds. So here the definition or a description of each thing is given. What is an abrasion? Abrasion means the injury of superficial skin layers. That means in abrasion only the superficial skin layers are involved. And here the management includes maybe with a simple dressing. Contusion means here a subcutaneous hematoma is formed, and that management will be of a conservative management and even with the pharmacological management and the heat dressings. Then if it is a hematoma, it is a large blood collection is called as a hematoma. So if it is a large, it needs a drainage of the hematoma. Then coming to the incised wounds are clean wounds. As we have discussed earlier, they are of clean wounds. So the management will be with a primary closure, where if you take a lacerated wound means that it's a irregular, contaminated, and the deeper tissues will be crushed in this type of lacerated wound. So here it needs mostly the debridement, and after the debridement, delayed closure. Then punctured wound means it is a deep contaminated wound, and here the in this type of wound, even the vital structures are also injured, and it as the vital structures are injured, it needs a very good observation, and also the intervention surgery is needed. Then the avulsion means the degloving injury raising the skin flaps is called as a avulsion wound, and here you can do the dressing of the wound along with the loose stitching. Then finally a crust wound means edema and bleed in the closed facial compartments can be seen, and even a tissue ischemia can be seen. There is a compartment syndrome which includes la edema, tissue ischemia, limb loss and renal failure. So all these comes under the compartment syndrome, which is very important. And here the treatment needed is early fasciotomy. And here we have seen that a degloving injury, right? So degloving injury is nothing but a injury to an extremity, finger, the injury of any arm or a leg or a foot in which soft tissue to the down to the bone, including neurovascular bundles and tendons, are sometimes peeled off. So in this degloving injury, this neurovascular bundles, tendons are sometimes peeled off. That means it involves a deep tissues injury. So you can see here picture, it is a contusion, whereas this is a abrasion. And here you can see the hematoma of the face, and these are the lacerations. And here there is a difference here. There is a low velocity bullet injury and a high velocity bullet injury. So this low velocity bullet injury occurs in a straight tract, whereas a high velocity bullet injury, there is a widespread damage to the cavitational effect. Remember these points. Then coming to the growth factors, which are very important in the wound healing. Okay, these growth factors will released by a variety of activated cells at the wound site, and they act in either paracrine or a autocrine fashion, so that they will stimulate or inhibit the protein synthesis by the cells in the wound. And these are the functions of the growth factors. It stimulates cells to proliferate, it induces the differentiation, stimulates synthesis and secretion of proteins, facilitate the attachment of cells, alter the shape of the cells, and cause the cells to migrate. And this is the list of growth factors given here. Epidermal growth factor, the main origin is from the macrophages, salivary glands, and keratinocytes. So salivary gland is important, and the effects of this epidermal growth factor will be keratinocyte and fibroblast mitogen, keratinocyte migration, and granulation tissue formation. If you take the transforming growth factor alpha, it can be originated from the activated macrophages or a T lymphocytes or a keratinocytes. And finally, the effects of this TGF alpha will be hepatocyte and epithelial cell proliferation. Then hepatocyte growth factor is originated from the mesenchymal cells, and it will have a epithelial and endothelial cell proliferation and hepatocyte motility. Then vascular endothelial growth factor is originated again from the mesenchymal cells. So these origins and effects are very important, and it will because of this there is a vascular permeability and endothelial cell proliferation can be seen. Then coming to the platelet derived growth factor. So as name itself, it originates from the platelets or a macrophages or a blood cells, smooth muscle cells or a keratinocytes. And the effects are chemotaxis, granulocyte and macrophage and fibroblast activation can be seen. Angiogenesis very important here, and wound remodeling and integrin expression regulation. So these are the functions of platelet derived growth factor. Then fibroblast growth factors 1 to 4 can be originated from macrophages, mast cells, or a T lymphocytes or endothelial cells or a fibroblast, and they will have a fibroblast chemotaxis or a keratinocyte migration, and here the wound contraction. So here it is important is angiogenesis, whereas here the wound contraction is important. Then coming to the keratinocyte growth factor, it will have a effect, show the effect of keratinocyte migration, proliferation and differentiation originated from the fibroblast. Then insulin-like growth factor, which originate from the plasma or platelets, which help in the endothelial and fibroblast proliferation. Vascular endothelial growth factor, angiogenesis. Then interleukin 1 alpha and beta will be originated from the neutrophils, and they will activate the growth factor expression in macrophages, keratinocytes and fibroblasts. So those are the important growth factors which plays an important role in the healing and even in the contraction of the wound. So if you take the factors influencing the wound healing, there are two types of factors: local factors and systemic factors. We'll see the local factors now. Local factors includes the infection, it delays the wound healing. Even the poor blood supply delays the wound healing. Foreign bodies also delays the wound healing. Movement of the injured part also delays the wound healing. Exposure to the ionizing radiation delays the granulation tissue formation, whereas exposure to the ultraviolet light facilitates the healing. So these are the local factors which influence the wound healing. Then coming to the systemic factors is, as all of us know, in the young patients and in the aged patients, the thing is the healing is delayed or is slow, maybe because of a poor blood supply or a reduced defense mechanism, whereas a nutrition deficiency of constituents like proteins, vitamin C, zinc delays the wound healing. Even the systemic infection also delays the wound healing. Uncontrolled diabetes Our people are more prone to the infections and hematological abnormalities like neutrophil functions like chemotaxis abnormality or any phagocytosis abnormality or any bleeding disorders will slow the process of wound healing. So we have seen in this video, we have seen about the classification of the wound healing and what are the types of wound healing, types of wounds, and we have seen what are the factors, growth factors which are help in the wound healing, and finally the factors influencing the wound healing which are very important. Okay, thank you.